Well, thank you for having me here. Thank you to the organizers. I think it's, so I'm going to be talking about the international perspective, who is doing bioethics research internationally, and specifically I'm going to talk about the region I work on, which is Latin America and the Caribbean. How do I get to the next? Oh, okay. This one? Okay. Many of you are aware of this exercise led by Fogarty some, I don't know, probably 5 years ago, 6 years ago, that involved a number of different assessments of the work done as a result of the bioethics training grants of Fogarty. And when I was asked to work on this, I started thinking, well, what has changed since we produced that assessment? And our conclusion was mainly, well, we've done a great work. The landscape of bioethics has changed a lot since 2000, but some challenges persist. And I'm afraid I'm going to say again that that's the conclusion. We've done even more than then, but some challenges persist. This was it looked like an easy project, but it was a very difficult exercise to the extent that you talk to people at lead training programs, and everybody wants to say what has been accomplished, and it's very hard to have the conversation about what we're not succeeding at. So what is it that we're not succeeding at? We looked at the work done by these people that have been trained, and the production is almost entirely descriptive, almost entirely empirical. And the main challenge that we found in all the training programs in the region is the need to develop analytic skills, the need to train people how to produce conceptual work. So this was not, as I said, this was a mega effort of Fogarty. And once all the pieces were together, there was a comprehensive assessment led by Joe Millen, Barbara Saenz, and Roger Glass. So they said, well, what is the lesson for Fogarty in terms of what we see in terms of bioethics training globally? That we need in-depth training. So I think that's exactly where we are now. We need the highest level of training in bioethics because we need to be able to produce knowledge on bioethics. And I want you to think, so many of you may be thinking that perhaps I'm exaggerating. And I think that the situation is particularly challenging for Latin America and the Caribbean. Go take the last 5 or 10 issues of Developing World Bioethics and tell me how many articles there come from Latin America and the Caribbean. You'll see that way more come from Africa, way more come from Asia, for example. So, but I think that we also have to have a little bit of a reflection of how, to some extent, unfair we are to bioethics as a discipline. So I think that there are in general like 3 levels of training. You know, you have like the training the people that at an IRB need, very basic research ethics training. Then you have some people that have a little bit more training, say someone that has a master's in bioethics. And then you have the experts, right? So what we need to do in the region of the Americas, in Latin America and the Caribbean mostly, is to go from step 2 to step 3, okay? And we find ourselves again and again and again expecting people that have taken courses on bioethics at a master's level to go ahead and teach bioethics. Let me tell you, how many of you have taken a statistics course as part of your graduate education? Are you ready to go start a biostatistics training program? Are you leading biostatistics research? Of course not. Why are we not treating bioethics the way we treat other disciplines? So we have to start thinking about this. Sometimes I feel like it's not because we deal with words that everybody can do this. We need to be a little bit more careful because what we see, we do again and again, is like we push people to train way too early in their careers. And then we end up, to some extent, reducing knowledge instead of increasing it. So the question is like, what's stopping us from taking that last step in the ladder? Well, you know what? It's very hard to train people to do something practical. Bioethics is an activity of doing analysis. It's a lot easier to pass knowledge. And, you know, this handful of experts, and I'm insisting it's a handful of experts that we have in Latin America and the Caribbean, are already very busy because they're involved in every global project that exists. You name it, you go to the meeting, they're going to be there, okay? So there's only 24 hours in a day. And and the type of work that's needed is very time-consuming. Then, well, it's very hard to teach new tricks to all dogs. Somehow, because we started this bioethics training enterprise when our priority was to institutionalize bioethics, as it were, we ended up prioritizing mid-career people. This fantastic anesthesiologist that comes to the bioethics class Thursdays afternoons, guess what? It's going to continue being an anesthesiologist. So, and it's going to be very hard for that person to embark on this new type of analysis that's needed for bioethics. I feel like if I could go back to the paper published in 2014, I would scratch that line and we included a recommendation about mid-career training. I think we need to start working with people earlier so we can do the whole process as, showed in Ben's table a moment ago. A last challenge is that we speak a different language, and I'm not exclusively talking about Spanish, I'm talking about a way of working. And I find, and I want to say, this is not just the way people do things in Latin America and the Caribbean. This is why we do bioethics in Latin America and the Caribbean. Because my cardiologist colleagues in Latin America and the Caribbean don't do this. They consume international cardiology literature, and they're more likely to produce or to engage in a global dialogue about cardiology knowledge. We somehow refuse to do that, and we're kind of like stuck in this cycle, and we need to somehow break that. And because instead of keeping telling us the story that the grapes are green, we really have to engage in the global dialogue that impacts us. So things are getting better. We're making progress, I think, and a lot of this progress is triggered by hard conversations with the people leading bioethics training programs. We at PAHO, we push them, we collaborate a lot with them. We do a lot of matchmaking work, also because we serve the member states that also want there to be bioethics expertise in the countries. Thank you so much.